Good day, learners and explorers. Welcome to our channel, The Psyche Dive, where we delve into the fascinating world of psychology. Our mission here is to break down complex psychological concepts into digestible bits, making them more accessible and understandable to everyone. We believe that knowledge is a tool for empowerment and change, and we're thrilled to have you on this exploratory journey with us. Today we're going to venture into a topic that touches many lives yet remains shrouded in misunderstanding: prolonged grief disorder. This is a condition that can profoundly impact the lives of those affected, often leading to significant distress and impairment. By understanding it better, we can not only enhance our own understanding, but also potentially offer support to those around us who might be experiencing it. So, without further ado, let us dive into the depths of prolonged grief disorder. To understand prolonged grief disorder, we first need to understand its classification in the DSM-5. The DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is the gold standard for classifying and diagnosing mental disorders. It's a comprehensive guide used by mental health professionals worldwide that helps them identify and treat a wide array of mental health conditions. One such condition, which we're focusing on today, is prolonged grief disorder. Prolonged grief disorder, often abbreviated as PGD, is a relatively new addition to the DSM-5. It was recognized in recognition of the fact that some individuals experience grief reactions that are so intense and long-lasting that they significantly impair their ability to function in daily life. But what criteria does the DSM-5 use to diagnose prolonged grief disorder? Well, the criteria is quite specific. To be diagnosed with PGD, an individual must have been experiencing intense grief and mourning responses to the death of a loved one for at least 12 months if the bereaved is an adult, or at least 6 months if the bereaved is a child. The grief and mourning responses must be characterized by intense longing for the deceased, intense sorrow and emotional pain, preoccupation with the deceased, and preoccupation with the circumstances of the death. The individual's response must be out of proportion or markedly different from what's expected given the individual's cultural and religious context. Additionally, the individual must exhibit significant impairment in social, occupational, or other important areas of functioning. This means that their grief is so overwhelming, it's impacting their ability to work, maintain relationships, or even carry out basic daily tasks. Remember though, a diagnosis of prolonged grief disorder isn't about pathologizing normal grief. Grief is a natural, albeit painful, part of life. It's about recognizing when grief becomes so intense and long-lasting, it's no longer a normal response, but a mental health disorder that needs treatment. Now that we know what prolonged grief disorder is, let's explore its types. Prolonged grief disorder is not a one-size-fits-all diagnosis. It can manifest in different ways. Just as grief is a personal journey, so too is the experience of prolonged grief disorder. It can show up differently depending on the individual and their unique set of circumstances. The first type we'll discuss is chronic grief. This is the most common form of prolonged grief, where the individual experiences a relentless, intense longing for the deceased that doesn't subside over time. Imagine, for instance, a grandmother who, years after her spouse's passing, still finds herself sobbing daily at the mere thought of him. Next, we have delayed grief. This is when the full impact of the loss is not immediately felt. The grieving process may start months or even years after the loss. Take, for example, a son who loses his mother, but doesn't begin to grieve until he becomes a parent himself and realizes the magnitude of his loss. Then there's masked grief. This occurs when a person unconsciously expresses their grief through other types of behavior. They may not realize their actions are a response to their loss. Think about a widow who, after losing her husband, starts hoarding items, unaware that this is her way of coping with her grief. Lastly, we have exaggerated grief. This is when the grief response is so intense that it leads to self-destructive behaviors like substance abuse or suicidal thoughts. Consider a father who, after losing his child, turns to alcohol as a means to numb his pain. Each of these types of prolonged grief disorder presents its own challenges and complications, yet they all share a common thread, a grief that lingers, that continues to impact daily life well beyond the period typically associated with bereavement. It's important to remember that if you or someone you know is experiencing any form of prolonged grief disorder, professional help is available. There's no need to navigate this journey alone. Now that we've gone through the types, let's talk about the symptoms. The symptoms of prolonged grief disorder are often intense and long-lasting. This condition is marked by a persistent yearning for the deceased which reaches beyond the boundaries of normal grief. This yearning can take many forms, from an overwhelming longing for the person's presence to preoccupation with thoughts of them. Alongside this yearning, individuals often experience a sense of disbelief or inability to accept the loss. They may feel that life is empty or meaningless without the person who's passed and struggle to envisage a future without them. This is often accompanied by a deep sense of loneliness, even when surrounded by other people. In addition to these emotional symptoms, prolonged grief disorder can also involve significant cognitive symptoms. Individuals may struggle with concentration, making decisions and carrying out routine tasks. They may also experience a sense of disconnection from reality, feeling as though they are living in a dream or that the world has become unfamiliar. Physical symptoms can also be part of the picture. These can include fatigue, sleep disturbances, and changes in appetite. Some individuals may also experience physical symptoms that mimic the illness or cause of death of the deceased, a phenomenon known as somatic mirroring. These symptoms are not just fleeting moments of sadness, they are persistent and pervasive, lasting for at least 6 months after the loss and causing significant distress or impairment in social, occupational, or other important areas of functioning. It is important to note that these symptoms go beyond the normal grief response. Everyone grieves in their own way and at their own pace. But when grief becomes prolonged and begins to interfere with daily life, it may be a sign of prolonged grief disorder. These symptoms can be overwhelming, but there are ways to manage and treat prolonged grief disorder. Recognizing the symptoms is the first step towards seeking help and starting the journey towards healing. Prolonged grief disorder may seem daunting, but there's hope. Various treatments are available. Let's delve into the different approaches used to help individuals navigate through these troubled waters. Firstly, there's psychotherapy, a vital tool in managing prolonged grief disorder. Cognitive behavioral therapy, or CBT, is one such form. CBT helps individuals understand and change thought patterns that lead to harmful actions or feelings. In the context of grief, it aids in identifying thoughts that may prolong or intensify the grieving process, with the aim of altering these thought patterns to enable healing. Another form of psychotherapy is grief counseling, which provides a safe space for expressing feelings and learning coping strategies. This therapy allows individuals to explore their loss, understand their grief, and ultimately move towards recovery. Interpersonal therapy, which focuses on the interpersonal relationships and roles that might be contributing to prolonged grief, is also an effective treatment. By improving these interpersonal issues, one can begin to alleviate the symptoms of prolonged grief disorder. In some cases, medication may be required as part of the treatment. Antidepressants, for example, can help manage symptoms of depression that often accompany prolonged grief. However, it's important to understand that medication is typically used in conjunction with psychotherapy, not as a standalone solution. Treatment for prolonged grief disorder is highly individualized, as everyone's experience with grief is unique. It's crucial to work with healthcare professionals to find the right treatment plan that suits you. Equally important is the role of self-care. Regular exercise, a balanced diet, adequate sleep, and maintaining social connections can all play a part in supporting mental health and aiding recovery. It's also worth mentioning that seeking help is not a sign of weakness. In fact, it's a testament to one's strength and resilience. It shows recognition of the issue at hand and the courage to tackle it head-on. Remember, seeking help is not a sign of weakness, but of strength. So we've learned quite a bit about prolonged grief disorder today. We've delved into the nuances of this complex condition, unpacking the DSM-5 classification and understanding how it distinguishes prolonged grief disorder from normal grief or other mental health conditions. We've explored the various types of this disorder, each with its unique characteristics and manifestations. We've also looked at the symptoms, a crucial step in recognizing and diagnosing prolonged grief disorder in oneself or others. And finally, we've examined the different treatments available. These range from cognitive behavioral therapy to medication and even self-care strategies. It's essential to remember that help is always available and it's never too late to seek it. This journey has been a deep dive into a topic that is often misunderstood. But it's our hope that this understanding can lead to empathy, compassion, and better support for those living with prolonged grief disorder. Thank you for joining us on this journey through prolonged grief disorder. Don't forget to subscribe to The Psyche Dive for more enlightening discussions. Until next time, keep exploring.